Good afternoon. Thank you for joining me for this Lunch and Learn. We're going to continue the conversation that we had last week. We had a lot of pushback on what we talked about last week, so I thought I would kind of bolster with some more information. So we talked about last week, we talked about how the World Health Organization had flipped on its lockdowns, right? So what we wanted to do is just to bring you some more information on that because, like I said, we had a lot of pushback on that. And so, feel free to ask a question when we're looking at this, and I'll try and get with you on answering that question if it shows up. Sometimes it shows up, sometimes it doesn't. So on this virus, 32,000 health experts have signed a declaration against the lockdowns. That's quite a lot of people, okay, who are doing this. It says more than 32,000 medical doctors and other health scientists from around the world. So this is not just here in the United States. It is from around the world. Have signed a petition against the lockdowns that have been put in place to curb the spread of COVID-19, saying that these measures are irreparable, they're causing irreparable damage, okay? As of October the 13th, that was 2 weeks ago, more than 23,000 of these signatories were medical personnel, 9,000 were health scientists, and they were in charge of public policy, okay? They've joined more than 400,000 members of the general public in signing this petition, okay? So these doctors are virologists and epidemiologists from Oxford University, Stanford University, and Harvard Medical School. So these are really the people that started it, that put it together. They're very, very well known. Okay, and this is what this article says. Current lockdown policies are producing devastating effects on long-term public health, okay? The declaration says lockdowns result in worsening cardiovascular disease outcomes, fewer cancer screenings, lower childhood vaccination rates, deteriorating mental health. Now, I really want to talk to you about deteriorating mental health because I've got a few articles on my desk. You can see my desk, I got papers everywhere. So the lockdowns are costing, according to one report, $16 trillion in lost income. Okay, that's a lot of money. Think about our national debt and how many trillions of dollars it is. This virus they're projecting is going to cost us $16 trillion in lost revenue from these lockdowns. So this is important, okay? It says keeping students, and we talked about this last week, keeping students out of school is a grave injustice, the doctors write. Instead of shutting everything down until a vaccine is available, the experts say focus should be on minimizing mortality and social harm until herd immunity, okay, is reached. Now, herd immunity is when a community, so many percent, some people say it's as low as 30%, some people say it's 70 or 80%, so it just depends on the virus. But the community, 30 to 70%, depending on the virus, has been in contact with the virus, has experienced the virus, has built up antibodies to the virus, and so they are no longer susceptible. As more and more people in the community become non-susceptible, then the community becomes immune to it because more and more people have been affected by it. Now remember, okay, the statistics, and these are the statistics that the politicians publish, right? There is 200,000 and something, okay? I don't know what the current number is, but over 200,000 deaths have been recorded in the United States due to the coronavirus, and that is not true. The CDC came out in, I think it was late September, okay? You're gonna have to look at that, but I think it was late September, who said that the numbers are wrong, that only 6% of that total is the number of people that have died from the virus. The rest of the people did have the virus, but they had the comorbidities that caused the death. So they made that distinction, okay? Yes, over 200,000 people have died. You're going to have people die. People die in car wrecks. People die in overdose. People die by suicide. People die, they just die. People die. Until we get, to the New Jerusalem, right? People are still going to die. But the CDC refined the numbers that only 6% of the total is directly due to the effects of the COVID-19 virus. This virus is 99.6% recoverable for most people, okay? You have to keep that in mind. So these doctors are saying if we let people do what they need to do, then the community will become experienced with the virus. They will become immune to the virus, okay, and it goes on. They say that the people that are at risk, so if you are obese, if you have COPD, if you have diabetes, if you have heart issues, then you need to be very careful because you are at greater risk of mortality with the virus. Is the virus going to cause the mortality? Not necessarily, but because your immune system is already weak, you're going to have a tougher time with the virus, and that's what the CDC has said, okay? It says our understanding of the virus is growing. We know that vulnerability to death from COVID-19 is more than 1,000-fold higher in the old and infirm than it is for the young. Indeed, for children, COVID-19 is less dangerous than many other harms, including influenza, okay? The declaration says public health officials should aim to protect the most vulnerable population while allowing those who are not vulnerable to resume their life as normal. So what does that mean, resume your life as normal? That means go around without a mask. That means go to the store. That means go to the theater. That means have sporting events. That means go and have holidays with your friends. That means all of the things that we've been missing out, to resume your life as normal. It says low risk young adults should be allowed to work normally rather than from home. Schools should be opened for in-person teaching, and extracurricular activities such as sports should be resumed, these doctors say, okay? Dr. Matt Strauss, who is one of the Canadian doctors who has signed on to this resolution, says, he told the Toronto Sun that most medical professionals that he has talked to agree with this, that the lockdowns are bringing more harm, okay, bringing more harm than benefit. He said, I don't even think that my opinion is a minority opinion among the experts that I work with. Okay, now we had a lot of people, well, not a lot, but we had people say, I'm not listening to you. This is on my video last week. I'm not listening to you. I'm listening to the infectious disease experts on the TV. And that's fine. You don't like what I'm saying, turn the channel. Don't send me hate mail, okay, because it's not going to change my opinion. My opinion is an opinion that has looked at research, okay? So if you don't like my opinion, that's fine. But I did have comments last week on the video saying, I'm not listening to you, I'm listening to the disease experts. So the disease expert that they're talking about is Dr. Anthony Fauci. He is the director of the National Institute of Allergy and Infectious Diseases, and he said the United States doesn't need another lockdown to contain COVID-19, okay? He's a member of the White House Coronavirus Task Force, and he said we can get through this without having to revert to another shutdown, okay? That's what he said. Okay, it says the UK people say maintaining the lockdowns will prolong the pandemic and increase the number of deaths. So you're looking at 32,000 medical experts that talk about this, okay? So that's important. So we have another article here that's talking about the lockdown. That's the theme of what we're talking about today is the lockdowns. Now, just to kind of segue into a personal story, I talked to my mom this week. I try and talk to her, multiple times a week and that kind of thing. She lives around the corner. She is older, of course, because she's my mom. And she does have underlying conditions. Why is that? Because she is a cancer survivor. She's had chemo, she's had radiation, so that means her immune system is pretty much shot. So she is one of those individuals who is at high risk. And she kept saying, I miss you, I want to have breakfast with you, because that's what we used to do. We used to have breakfast, occasionally, regularly, but, not every day. And I asked her, I said, well, Mom, I said, are you afraid to go out and have breakfast? She goes, well, yes. Well, aren't you? And I said, no, I'm not afraid. Now, why am I not afraid? I'm not afraid because I have absolutely no comorbidities, right? I know that if I got the virus, I would have a 99.6% chance of recovering from the virus. Now, do I want to get the virus? No, I don't want to get the virus, but I'm not particularly afraid of the virus. That being said, Mom said, do you want to go out? No, I really don't want to go out. And why is that? Because then you have to fight with people. Not fight really, but they have this big poster on the door that says mask required, don't come in without a mask. And guess what? I don't wear a mask. It makes me hyperventilate. It makes me sweat. It makes me get very anxious. It's not healthy for me to do that, so I don't do that. Most of the time when we go into the store, we go into the restaurant, they'll say, do you want a mask? No, thank you. I can't breathe with a mask and I have a health condition and we're not doing that. And I have absolutely no hassle. But it is that they want you to do this, you don't want to do this, so there's that inner conflict there, which makes going out not fun, okay? As a small business owner, I understand that we want people to come in, we want people to, shop with us, we want people to make their appointments with us, and when people are afraid to do that, our business suffers. I'm looking at our community, and we have small businesses who the manager, maybe not the owner, but the manager makes masks a big hassle. People don't want to spend their money there, so the owners are losing their income because of these public policies, right? And this is part of the lockdown, stay home, stay safe, wear a mask, all that kind of stuff. So here we're talking about the lockdowns, and the lockdowns are causing a lot of mental health issues, okay? Mental health issues have increased, I think it's like 44%, okay? They did a survey in California, and then they extrapolated that information throughout the rest of the United States. It says America at large has followed a similar pattern to California, with almost 41% of adult respondents, okay, nationwide, reporting symptoms of clinical anxiety or depression during the third week of July. So 41%, of course, is less than half of the population, but it's very, very close to half of the population. So this lockdown is affecting all of us to a lesser or greater extent, all right? It says that by comparison, just 11% of the population in the United States, adults, reported those symptoms in a similar survey that was conducted in 2019. So in 1 year, we've gone from 11% of the adult population having anxiety and depression to 41% of respondents saying that they're having anxiety and depression. The July responses showed a marked geographic variance with residents of western and southern states where the virus remains the most virulent, registering greater mental anguish on the whole, okay? Most adults have been moored at home in forced stasis. That means being stagnant, not moving, not going out. Many in relative isolation, all right? The unemployment rate hit its highest rate since the Great Depression in the 1930s. I don't know if everybody is aware of this. I know that we had our statistics that came out yesterday that the gross national product had increased by 31 something percent, or maybe it's 33%. Anyway, we're coming out of it. Thank God we're coming out of it. But this has been something that has been a real legitimate cause for depression, is people not being able to go to work. If you don't go to work, you don't get paid. If you don't get paid, you can't pay your rent and pay your car note and pay your insurance and buy groceries and all that kind of stuff. And so financial deprivation is very, very depressing. If you are a husband, if you are the breadwinner of the family and you cannot provide for your family, then that is very, very depressing, okay? It says thousands of families across California and tens of thousands across the United States have lost people to the virus. There's no clear indication when or even if life will return to normal. And this is what's very interesting. The pandemic, the first wave of the pandemic, is what we're in now. It says the second and third waves are really going to be this behavioral health piece. This says Jessica Cruz, who is the executive director of the National Alliance on the Mental Illness in California. All right. In the weekly online surveys over 3 months, the Census Bureau asked questions to about 900,000 Americans about the quality of their life and their levels of anxiety and depression. The survey questions were modified versions of the common screening that medical physicians will do when they're dealing with mental illness. It says, interestingly, right, in both California and the nation, symptoms of depression and anxiety were more pronounced among young adults and generally decreased with age. For example, nearly 3 in 4 of California respondents between the ages of 18 and 29 reported that they are no longer able to stop or control worrying. 71% of the population reported feeling down, depressed, or hopeless during that time. Interestingly, okay, people that are 80 and older, now these are the people that are most susceptible to mortality from this virus, right? They said that they weren't that depressed. They reported nowhere near the same level of distress. Just 40% reported feeling down or hopeless for at least a few days of the previous week, where 42% reported uncontrollable worry. So that's almost half. So if you have, what did it say up here? 71% down to 40%. That's not quite half, but you know what I mean. It's quite a bit of reduction there. All right. So this is important. What are we doing for our seniors who are depressed? What are we doing for our young people who are depressed? This is really important. All right. It says the census survey also found higher rates of depression and anxiety among those who had lost their jobs during the pandemic. Young adults in the service industry have been suffering, and I think their percentage rate is like 20%. So it used to be only like 11%. Now it's 20%, so it's more than doubled. And why is that? Because restaurants were forced to close, bars are forced to close, the hotels, you know, they make you wear the mask. You can't get on an elevator unless you're the only person on there. So they're really making it to a place where you don't want to go out. You don't want to travel. I don't want to travel. I go to conferences all the time. I do educational events all the time. I don't want to do that. Why? Because there's just too much hassle. Don't want to do it. So because of that, the fallout from that, everybody's staying home, not going out, the lockdowns, these young people who are the backbone of the service industry, then they're feeling really, really depressed. It says that the unemployment rate among U.S. workers ages 20 to 24 was 18%, comparable to 9% if you're 25 to 54. Okay, that's a huge discrepancy in that. So we need to be very, very aware of what's happening in our community. We need to be aware of what's happening to our loved ones, whatever age group they fall into, because most people are having effects of anxiety and depression with this lockdown. It says the experts worry that the tumble toward depression and anxiety could outlast the pandemic itself, particularly if the economy lapses into a prolonged depression. So that's what we don't want, all right? So continuing the theme with the lockdown and the depression, here we are. The economists estimate a financial toll of COVID-19 on the United States to be $16 trillion. It says approximately half of this amount is lost income from COVID-19 induced recession. The remainder is the economic effects of shorter and less healthy life. Now, why are people having shorter and less healthy life? Because when you're depressed, when you have anxiety, panic, and that kind of thing, what are you going to do? You're going to turn to substance abuse, you're going to turn to alcoholism, and you're going to turn to suicide. So you're going to engage in those behaviors that shorten your life, and that's what we don't want, okay? We don't want anybody to fall off the face of the earth with depression and anxiety. So we really need to be listening to what these experts saying about the lockdown being very, very detrimental to our health, okay? So estimates by Summers and Cutter, these are the economists, as to the direct economic losses are consistent with earlier projections by the Congressional Budget Office, which projected that the pandemic would, over the next decade, cost the United States nearly $7.6 trillion in lost gross domestic product. That's a lot, okay? $7.6 trillion. In estimating the remainder of the 16 trillion virus hit to the United States, the two economists sought to gauge the value of COVID-19 premature deaths, long-term health effects, increase in mental health conditions. Okay, and they do this whole formula about how they figured that out. You don't care about that. I don't care about that. We just don't want to be that statistic. Okay, it says they assumed also that 29 percentage points in additional reported cases of anxiety and depression since April compared to the same period in 2019 could be attributed to the effects of the COVID-19 lockdown. I want to tell you that again. 29 percentage point growth of depression over the year, okay? The same month a year ago, 29% increase in depression and anxiety is attributable to the effects of the COVID-19 lockdown. This data translates to an estimated 80 million additional individuals with these mental health conditions related to COVID-19. 80 million people being depressed, okay, because of COVID-19. This is a huge thing. This is something that's really, really important, and I hope that our government officials are paying attention to what these people are saying, not to what I'm saying. They don't care what I'm saying. I'm getting this from a national newspaper. I'm getting this from the Epoch Times. I don't know if you read that, but it's a really good newspaper. It tells you stuff you're not going to hear on the mainstream media. You're not going to get in your local paper and that kind of thing. And it's very, very reputable, and they tell you things that are very, very important. So I'm really hoping that people who are the policymakers, people that are the influencers, people that do work in the public health sector, that they look at what these 32,000 doctors are saying about the lockdown and they revise their recommendations accordingly. Again, paying attention and having provision for the vulnerable in the community, okay? But young people, healthy people, people without comorbidities need to be able to get on about their life, because we're having 80 million people, okay, an increase of this with mental anxiety and depression, okay? This is important. It says, if In line with the previous estimates or the prevailing estimates, the cost of these conditions is valued at about $20,000 per person per year, okay? The mental health symptoms lasting only 1 year, and of course we know once you're depressed, you can be in a cycle of depression that continues year after year. The valuation of these losses could reach approximately $1.6 trillion. The total of these estimates comes to $16.1 trillion, or around 90% of the GDP in the United States. That is a huge price tag to pay for a virus that is 99.6% survivable, okay? So please look at the information. All of that came from the Epic Times. You can go to their website, you can look at it. I'm reading it from the newspaper, okay? I'm not making this up. This is important. Whoever you're responsible for, I'm responsible for my family. I hopefully have influence over my children. I hopefully have influence over my patients. I hopefully have influence over my grandchildren and all that kind of stuff. We want everybody to be healthy. We don't want to deal with depression. I had a lady in my office this morning, and she was telling me that she lost a child to suicide. Now, this was a few years ago. This was not because of COVID-19. But still, I love my children. I cannot imagine my life without my children. If we are going to continue to participate in these lockdowns, there are going to be more and more people who are going to suffer more and more anxiety, who are going to suffer more and more substance abuse, who are going to suffer more and more suicide. So please, please, please get this information out. I appreciate you sharing it. We had quite a few shares last few times we've done a video, and I do appreciate it. The more people hear, not conflicting opinions, but maybe there's more to the story. As Paul Harvey used to say, people can make the best decisions for them and their family and their own state of the health that they individually are in. Like I say, my husband and I, yes, we're older, okay? We're past the 63 that the FDA says or the CDC says that are most at risk, but we do not have the comorbidities. So the comorbidities, it what causes you to have more of a risk of mortality with the virus. I say this all the time. The vaccine's not going to help you. The drugs are not going to heal you. What's going to heal you is your own immune system being up for the challenge. Yes, if you get sick, yes, if you go to the hospital, I want you to take the drugs, okay? So don't misunderstand what I'm trying to say. The best defense against this virus is to make sure that your immune system is nice and strong and healthy. And how do we do that? We do zinc, we do vitamin C, we do vitamin D, and we are among people that we share the microbiome with so that we generate herd immunity so that this will pass and it will not be any more than just a blip on 2020. So that's my goal, that's my hope. If everybody gets smart, if everybody takes responsibility for themselves and the people that they love, maybe we can kind of move through this path and not have this increased depression and increased suicide and that kind of thing. So there are real dangers to the lockdown. Educate yourself. Make your best choice for you and your family. It's the weekend. Colder weather is here. I know hunting season starts, I think, maybe today, maybe tomorrow. I don't know, November. I know we're a couple days away from November. So just be good to yourself. Do self-care. Pay attention to some of this information so that you can make the best decisions for you and your family. Don't send me hate mail. I love you. I'm sharing this out of my extreme concern for us as a country, for us as a nation, okay? I want us to be healthy. I want us to be safe. I want us to come through with this. Now, I see that we have quite a few questions, and I will get to them. Thank you so much. I appreciate you, and I will see you next week. Have a great weekend, and do self-care.